Good morning. My name is Jeremy Pastor with
Christina Seminario.
We will be talking to you about humor used in the hospital setting. Welcome to Ha Ha Healthcare. Today, our learning objectives are identify 3 physiological benefits of humor.
Describe the principal way in which humor benefits staff members.
List the various strategies in which a staff member can use humor in a culturally competent way.
Define harsh humor.
And lastly, explain how humor can be viewed as ethical. Humor is an essential part of everyday life. Laughter not only has a positive psychological effect, but also a helpful physiological effect on our bodies. Nurses who use humor during their caregiving hours can agree that this is a constructive form of therapeutic intervention. Humor benefits both patients and their nurses. Although it is universal that humor can be used to uplift a patient's well-being and spirits, humor also should be individualized to fit a person's culture and appropriate time of need. So therefore, humor can be used in a negative way, and therefore cannot always be therapeutic. Humor has many more aspects when it is studied from a healthcare perspective. Some may actually agree with the idea that sometimes humor is detrimental to the patient and that it can be offensive rather than beneficial. In this PowerPoint, we will also view humor from an ethical standpoint, whether it is appropriate or inappropriate when used by the caregivers rather than the patients. Humor has been well established in showing benefits to the human body. Physiologically, it strengthens the respiratory system. It also increases the amount of oxygen in the bloodstream. It increases the heart rate and accelerates breathing and circulation, and it helps relax muscles. In addition, it has been found that laughter releases natural painkillers into the bloodstream, and in this way increases feelings of well-being. Here is a physiological question. Which one of the following is a physiological benefit of humor? Now, we just went over this, so you should know. A, relax muscles. B, decreases oxygen in bloodstream. C, tenses up muscles. Or D, lowers immunity. What do you think it is, Christina?
I think it's A, relax muscles, and I'm right.
And so are you guys, because you guys are paying attention. Let's move on!
Through psychological effects, there is evidence that humor can help cure diseases. Since humor creates a more relaxed atmosphere, this allows the nurse and patient to interact in a more trustful environment. Such an environment relieves anxieties, tensions, fears, and uncertainties by allowing a safe and acceptable outlet of pent-up emotions. Some studies suggest that humor can also serve as an escape or defense mechanism that help people avoid anxieties. And now we're going to ask you a question. A nurse plans to use humor to relieve the patient of psychological stress. Which of the following symptoms displays a therapeutic response? A, increase in heart rate. B, increase in sweat production. C, shallow breathing. And D, patient openly speaks to the nurse about family and personal problems. If you answered D, you are correct. If you didn't, you are wrong.
D shows that the patient is increasing their trust for their nurse. At this time, we're going to show you a video clip.
Hi.
Hi,
What's your name?
Cameron.
Hi, Cameron. I'm Patch.
I have a cold. Just a bit of a cold. Is my nose red? Oh, it is. It's red.
What's that? You don't know?
I don't either.
Let's find out.
Taxi!
Try on you.
It's working very well.
Bee kisses.
Hi. Mind if I sit down? Hello, my friend. Hello. Oh, look out.
What is going on here?
Down. Sit in your beds right now.
That clip was taken from a movie called Patch Adams. Robin Williams was using humor as a therapeutic intervention for the patients in the children's ward. As you can tell, tensions and anxieties were relieved during the time that Robin Williams brought smiles to these patients' faces. Not only that, but you can imagine that physiological benefits that we discussed were also taking place there.
So far, we have focused on how humor is beneficial to patients, but research also shows that humor is of assistance to medical staff. Nursing has many theories, and Wooten is one of the few nurses to use humor theories. Nursing theorist Wooten suggests that a humor workshop for nurses can reduce some of the symptoms of burnout by enhancing sense of power and control, and thereby nurses' propensity for burnout. Humor is valued for enabling communication, fostering relationships, easing tension, and managing emotions. Adding humor builds a sense of community, which energizes a team and solidifies mutual support. A supportive framework within the staff is important for the nurses. Laughing together is a way of bringing people together and building trusting relationships, which ultimately strengthens the team. The nursing team is then equipped to withstand stressful situations, knowing that they have each other's support. Humor adds emotional flexibility to nurses. There's a study in which PCU and ICU areas are studied. In both areas of PCU and ICU, nurses would rapidly shift from a failed scenario to an admission with no time to realign their emotions. By becoming powerless to control circumstances, nurses attempted to control their emotional reactions. Humor allowed emotional flexibility to respond to a now different set of circumstances, rather than dwelling on a difficult situation that had already occurred. And now it's time for another question. During pre-conference, the nursing manager states the benefits of humor for the nursing staff. Which one of these options is not a benefit to the staff? A. Fosters
Camaraderie.
B. Opens ways for emotional flexibility. C. Increases chances of burnout. Or D. Increases communication between nurses. If your answer was C, you are correct. One of the benefits of humor for the nursing staff is that it decreases chances of burnout.
Cultural differences. You see, despite humor being a universal social phenomenon, each culture has their own set of beliefs and values that may affect how therapeutic humor is delivered in nursing care. Since humor is the foundation of most communication, being aware of each person's culture can help gain insight into an individual's collective perception of what is considered humorous. Within the hospital, nurses will be faced with multiple situations that may lead to the difficulty of deciphering what sort of humor is appropriate and inappropriate for the occasion, especially with patients from different backgrounds from their own. You see, me being Filipino and American primarily, can find it difficult if I were to handle somebody who would be maybe African and freshly new into the US. So gauging what kind of humor they may or may not accept is important to building a trusting relationship. By overlooking the cultural insinuations of therapeutic humor, nurses might end up causing negative reactions from their patients and break any possible form of trust. By paying attention to these cultural differences, nurses can turn humor into a beneficial psychological and physiological effect. Nurses must be aware of the complexities involved with therapeutic humor in order to supply culturally appropriate interventions to individuals from a variety of ethnic and racial backgrounds. With increased awareness, nurses can close the gap between clinical application of nursing knowledge and curriculum content used to teach nursing students. Humor is considered to be a form of communication, as we've been stressing. By understanding how to use therapeutic humor in the right way during communication shows that nurses are willing to go above and beyond to become aware of patients' needs. By recognizing therapeutic humor in healthcare situations, nurses can facilitate trust with their patients even if there is a cultural difference. Now let's take a gander at this question. As a new immigrant to the US, a patient is about to go into surgery. The nurse says, "Did you hear about the guy who lost his whole left side? He's all right now." However, the patient does not react at all. What is a possible cause of this reaction? A. Patient is deaf. B. Nurse did not assess patient's culture appropriately. C. Patient is too nervous to respond. Or D. All of the above. Well, if you answered D, you would be correct. All of these answers would be possible. Remember, however, at B, you must assess a patient's culture. If you do not, you cannot gauge how well they can accept any sort of humor that you decide to use. We're gonna take a look at another video. Let's go.
Code Brown, South Core. Oh my God, Kevin! Kevin! Wow! Whoa. Kevin! Hurry! 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 Oh, okay. Oh, yes, yes. I'm sorry.
Humanity of it!
Doctor, we have an ESL of 10 liters.
ESL?
Assassinated stool loss.
Oh, okay. We need 2 grams of Imodium IV stat Someone call anesthesia. We need rectal intubation as quickly as possible. And
Interview the staff.
where the hell is the oxygen? Okay, we got oxygen.
I am Dr. Schmidt, Professor Emeritus from the Vienna Institute of Psychoproctology. Any cold can have great stress on all of the staff. The cold brown can have tremendous impact on all of the people involved. Its effects on the other patients and on the staff, devastating.
Here, get in there. Start cleaning.
But I'm just an intern.
Dr. Wittenhauser, with all your experience and vast knowledge, what do you think we should do in this situation? Doctor? Doctor!
The cold brown is a very dangerous situation for everyone involved. And quite frankly, the casualty rate for the staff working on the cold brown is very high.
Ken, no, don't go so close, no!
I need you to focus here. I need you to focus and just do what we can do. Ken is gone. He's gone. There's nothing we can do for him.
But we must never forget that the cold brown also brings out the best in people as well. And it is under just such circumstances that heroes are born. There's a PCA.
I'm here. With the washcloth. So, clip solution. Oh! I'm here. No, I can't.
No! Is this patient even a full code?
He's not even a full code. He is not even a full code.
Well, this is clearly a nursing issue.
What time is it?
You know what? We're just going to do what we always do. It's 3 o'clock. We're leaving it for the next shift.
Oh, it is 3 o'clock. We are so out of here.
After watching this video, you were able to see how humor can be beneficial to the staff. The funny interactions that occurred between the nurses and the surgeons made them work as a better team, and it helped form a community within the staff.
Now, let's take a look at a new kind of humor. Harsh humor. First off, let's find out what harsh humor is. Harsh humor is humor that points out a patient's anxiety, embarrassment, and or physical symptoms. It can be used both positively and negatively. When used inappropriately, humor can come across as very crude and harsh. Through negative case analysis from a constructive grounded theory study on a spontaneous humor and a clinical nurse specialist, we will learn that there are scenarios that can use harsh humor very wrongly. Humor is not entirely a positive phenomenon, but also a potential detrimental hazard. Harsh humor can be acceptable because it can help ground the basis of what patients feel comfortable with. By expressing harsh humor, nurses can display that they can culturally be at the same level as their patients, depending on their background. This is a form of trust building where the patient can relate to how the nurse supplies care. In the case study of the CNS was taking care of a patient who was a prostitute and unfortunately got sexual transmitted diseases. While during the care, the CNS would joke about prostitution. Even though the patient would be open about the idea that prostitution was something that she chose to do, jokes towards prostitution was still hurtful and did not work in a therapeutic way at all. This study teaches us that it is important to be cautious about using humor in similar situations as well as clinical practice in general. Using harsh humor in particular is already risky to use as initiate humor. Therefore, it has great potential to cause great offense. Hopefully this article has raised awareness of humor in healthcare interactions. This may be beneficial towards understanding its role and purpose.
Which one of the following statements is false about harsh humor? A. Harsh humor is humor that points out a patient's anxiety, embarrassment, and/or physical symptoms. B. If used wrongly, can come across as crude and harsh. C. Some find it acceptable because it can help ground the basis of what patients feel comfortable with. D. Never be cautious if considering to use harsh humor.
If you answered A, you're wrong. If you answered D, however, you are correct. Always be cautious if considering to use harsh humor.
All along, we have focused on the benefits of humor. But is the use of humor in a hospital setting ethical? Katie Watson, ethicist, presents this current issue in her articles Gallows Humor in Medicine. According to Watson, gallows humor is humor that treats serious, frightening, or painful subject matter in a light or satirical way. She provides us with a good example in her article. And it goes like this. It was 3 a.m. and 3 tired emergency room residents were wondering why the pizza they had ordered hadn't come yet. A nurse interrupted their pizza complaints with a shout, "GSW Trauma 1, no pulse, no blood pressure." The residents rushed to meet the gurney and immediately recognized the unconscious shooting victim. He was a teenage delivery boy from their favorite all-night restaurant, and he'd been mugged bringing their dinner. That made them work even harder. A surgeon cracked the kid's ribcage and exposed his heart, but the bullet had torn it open and they couldn't even stabilize him for the OR. After 40 minutes of resuscitation, they called it. Time of death, 4 a.m. The young doctors shuffled into the temporarily empty waiting area. They sat in silence. Then David said what all three were thinking. "What happened to our pizza?" Joe found their pizza box where the delivery boy dropped it before he ran from his attackers. It was face up, a few steps away from the ER sliding doors. Joe set it on the table. They stared at it. Then one of the residents made a joke. "How much do you think we ought to tip him?" The residents laughed. Then they ate the pizza. Although Katie Watson heard this story and wasn't sure what to say, whether this was ethical or not, she later goes on to say that joking seems to move the analysis forward, or that sometimes a joke is used about a tragic circumstance, such as this pizza delivery man, as functional shorthand to speak a truth no one else was willing to say. She also attempts to explain the reasoning behind humor by stating that external obstacles are powers beyond our control. And when you can't address your problems directly, laughter is a more helpful response to anger. However, we also know that humor at times can hurt feelings. So it's a little bit hard to find whether it is ethical or unethical. According to Katie Watson, once again, humor in healthcare can be a form of coping for the staff member. Therefore, it cannot be generally categorized into ethical versus an unethical standpoint. Humor is used as a very strong coping mechanism for staff members, but at times the jokes they may say may hurt other people's feelings. So it's more of a situational viewpoint.
The nursing supervisor educates the nursing student on what gallows humor is. The supervisor knows that the student fully understands by saying that gallows humor is A. Humor that uses irony to mock or convey contempt. B. Humor that treats serious, frightening, or painful subject matter in a light or satirical way. C. An instrument of execution consisting of a wooden frame from which a condemned person is executed by hanging. Or D. Humor that is silly, immature, or indicates a lack of maturity. If you've been paying attention, you would have said B. Good job.
Humor is much more controversial when included in healthcare than one would have expected. The problem with humor is that it is strongly subjective. Humor is acceptable when it consists of making hospitalized children laugh. But humor becomes inappropriate when a medical resident jokes about the death of a patient. Some believe that humor is marked appropriate or inappropriate depending on the reasoning behind the joke. But who can truly know someone's thoughts? Using humor with your patients may result in health benefits and reduced pain, or it may result in hurt feelings or offended patients of different cultures. So we must remember that patients and staff can benefit from humor, but also keep in mind that there are differences between cultures and that we have to keep those differences in mind when using humor, because this can result in negative aspects to humor. But whether it's ethical or unethical is more of a personal decision. We may offend different people of different cultures or hurt feelings of people who may be the same culture as us. But where is the line drawn? There is no way of knowing the result without taking the risk. However, is the risk worth it?
Now we're going to give you some lifelike scenarios on humor being used in the hospital. See if you can determine whether these are deemed as appropriate or inappropriate. Good morning, Mrs. Smith. How are you feeling today?
Alright, not too well.
Are you feeling stress? How about tension? Maybe panic?
I'm very stressed.
Very stressed? Well, do you know the difference between feeling stress, tension, and panic? Well, stress is when your wife is pregnant. Tension is when your girlfriend is pregnant. Panic, that's when both of them are pregnant. Am I right? Seriously, you're sick. Mrs. Smith, do you know where we are? Have you been playing hide and go seek with me? Cause I see you. Alright, Mrs. Smith, we're gonna do that procedure that I told you about earlier. Ready? Mrs. Smith, I said I would listen to your heart. Oops. Oh. 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 Alright, Mrs. Smith, let me just take a look here. Did someone just have lentils, or is that poop? Well, Miss Smith, it looks here that your blood sugar is high. So, ain't no sugar for you. Well, Mrs. Smith, hola. It looks like you have about 20 family members here to see you today. I mean, this isn't a car trying to hop over from Mexico to US. Mrs. Smith, we have some bad news and some very bad news. What would you like to hear first?
Guess I'll hear the bad news first.
Well, the bad news is, according to your lab test results, you only have about 24 hours left to live.
That's terrible. What could be worse than that?
Well, I've been trying to get in touch with you with these results since yesterday, so... I'm just kidding. I'm just kidding. That's not gonna happen. Ooh, you should have seen your face. You should have seen your face. It was like... oh, okay. It really wasn't, but... Mrs. Smith, I'm happy to say that you are in good health. In fact, I'm pretty sure that you will live to be 80.
The doctor, right now I'm 80.
What did I tell you?
Well, as you can see, this is the end of our video, of our presentation. And this is our references slide. And if you would like to find more information about it or read more information on your own, you can always search these articles and Apply this to your personal nursing career. We hope you enjoyed it.
And we'll apply this to your life. Bye-bye.